Nigeria's secret police, DSS, gave Nnamdi Kanu only 2 out of 7 bottles of prescribed medications. Lawyer Ejiofor demands urgent medical care. So Kanu, out of the 7 prescription medicines they gave him, the doctors prescribed is only 2 they gave to Nnamdi Kanu. Means that they are slowly killing him there, if that is true. So Kanu's health has recently got worse, according to the Ipob lawyer. Ifeanyi Ejiofor, lawyer to the detained leader of the indigenous people of Biafra, Nnamdi Kanu, has asked the Department of State Services, DSS, to allow family members to donate money to enable the Ipob leader receive urgent medical care. The call was made on Monday by the pro-Biafran group's counsel, Ejiofor, who had just returned from a routine court-ordered visit to the DSS headquarters in Abuja, where Kanu had been detained in solitary confinement for more than 14 months. Kanu's health has recently got worse, according to the Ipob lawyer. In a statement on Monday, Ejiofor said the DSS, in a feeble attempt at improvisation in order to cure a serious health condition such as the one confronting Kanu, only succeeded in procuring 2 doses out of the full dosage of 7 bottles of the prescribed medications. Oh, so okay, DSS was supposed to provide that medication according to the court order, but they refused to do that. In normal way now, even when they have the money, probably somebody will cut his own cut, take his own cut, and what will be left will not be enough to buy the full dose of the medication. Or conversely, they may not want to give him the full dose because they want to punish him. It will be very, very bad if Kanu dies in that custody. Now, the 2 doses were exhausted on Saturday, 21st September 2022. The effect of the prevailing situation is that the limited dosage of the prescription Onyendo was provided with is just a drop in the ocean, which did not achieve the desired result. So they're calling Nnamdi Kanu Onyendo here. So the limited dosage they're giving him is actually bad for his health. Now, the lawyer claimed there was no longer any question that the DSS had exhausted all therapeutic alternatives for treating Kanu's severe medical condition. Hence, our passionate plea is for the unconditional release of Onyendo to enable us to seek proper medical attention. Otherwise, we should be allowed to provide the required funding to the DSS to enable them to purchase the complete prescribed medication for Onyendo, or we could procure them ourselves in order to ensure that Onyendo leaves the DSS facility in good health condition upon regaining his freedom soon, Ejiofor added. Meanwhile, the lawyer hinted that Kanu would not be appearing in court on the 4th of October 2022. Umu Chineke will be informed via this platform or other approved channels of communication whenever Onyendo will appear in court. Kindly ignore the false rumor currently in circulation, Ejiofor advised. More so, the Ipob Council disclosed that Kanu was profoundly elated by the outpouring of prayers, good wishes, and solidarity on his special day on earth. He requested the expression of his heartfelt gratitude to you all, Umu Chineke, followers, friends, families, and all lovers of freedom across the globe, for massively celebrating him on his birthday. He does not take this for granted. So what is happening here is that Nnamdi Kanu has been in the custody, under DSS custody, actually was supposed to have some medications. And what the lawyer is saying that out of the 7 medications prescribed for him, DSS only provided 2, meaning it's either they don't have money to procure the complete dosage, or they probably wouldn't want to do it in a way of punishing him, or the same way of corruption in Nigeria where money is released for something and it will not be wholly spent on that thing because people will have to take different cuts. The level of corruption in Nigeria now, you never can tell how low people can go to get some cuts of their own. out of a meager budget for a purpose. That is how it is in Nigeria. But what he's saying is that DSS should allow, if they are not going to be able to provide that medication, they should allow family members to contribute money to give them to buy that medicine, or allow family members and well-wishers and lovers to directly buy the medicine and bring to him there, so that by the time Nnamdi Kanu regains his freedom, he will come out in good health condition and not escalated health condition, right? So somebody is saying here, why are Nigerian agencies disguised death squads? You deny a detainee prescribed medication and you say you are doing policing. I have always said that the entire Nigerian police be demobilized or all the personnel retrained, but the IGP is just sitting on his hands and hoping that tomorrow would be good after things improve. So you see what this guy is trying to say is that these agencies are disguised death squad, meaning they kill people slowly or other willfully or unwillingly, consciously or unconsciously, by their actions, omissions, and commissions. People die under their care, and sometimes they don't care about that as well, you know. So and it's possible because you never can tell people's intentions. Another person is saying, them try. Good, they didn't substitute pills in the 2 bottles with lookalikes. You see? So somebody is saying here, they tried, even the 2 when they give them. Say, thank God that those ones were not substituted. Maybe put poison inside the same bottle, and then someone will go and drink them, taking that the actual content, meanwhile the actual content, just to kill somebody fast. So if the 2 bottles they gave him are genuine bottles of the genuine prescription, it means that they have tried. That is what this person is saying. Because it is possible they switch the content inside the same bottles or inside the same containment, and then give it to him to drink. And can be erroneously taken is the medication, meanwhile it is not. And that can aggravate his health condition. So if they gave him the 2 bottles as the genuine prescription, then they have tried. So, but even if they have tried, they should allow the family members to procure the remaining ones if they can't, and let them be open. Let them openly tell the family, we don't have money to buy this one, so buy them and bring them. But because they don't have good heart towards that, they won't do that. So somebody saying here, get 2 years. Okay, no, this is not. This is a kind of advert here that I'm seeing. So that is what someone is saying there. That they tried, even if the 2 bottles they gave to him are genuine bottles. But generally, it means that the kind of medical care that the court ordered DSS to give Nnamdi Kanu under their custody is not what they're giving to him. And that has to be corrected. Even though he's detained, they don't really have any case against him. Recently, they've quashed some of the charges they counted against him, but they still don't want to release him because they have their own reasons. But generally, even the human rights globally have asked DSS and the federal government to release him. They still don't want to release him because they have their own plan, which we don't know yet. But it is obvious that that man has not committed any crime. They can't sentence him. They can't finish his case. They can't imprison him. They can't release him. They just locked him there. Is that not incapacitation? They just technically and tactically incapacitated him for this period. He's been under their custody for 14 months now, according to the lawyer. But that's not fair enough. If you don't have any case against someone, you release the person and let the person go free. If you have a case, expedite the case and conclude it, and then imprison the person if you have to. So, but this one that you detain people for months and for years without genuinely finishing up the case, it doesn't make. Sometimes they forget people in detention. Kanu's own he's even lucky that he's getting attention even in that detention, because there are some people, unknown number of people that have been forgotten in detention. No court case, they don't appear in the court. Nobody knows them. Only their family knows that their family member is in detention. Nothing is happening. Something has to be done differently in our judiciary system. All right. Thank you for listening, and can put your comment down below. That is the state of Nnamdi Kanu under DSS custody.